Hello, hi, namaskar. I am Oswani sir. Welcome to the osssc Academy online study. In this content today, we will be discuss about the nursing care plan important MCQs with rationale, so that you can learn faster, understand deeper with confidence. So before having any delay, let's start. Question number one: which of the following is the first step of nursing process? Assessment, planning, implementation, evaluation. The correct option is assessment. Assessment is the first step of nursing process because it is necessary to gather data about the client's condition before planning care. Nursing care plan is a options are legal document, communication tool, written description of nursing care, all of them. The correct option is all of the above. The nursing care plan is the communication tool that helps to ensure that all the nurses of the healthcare team and the aware of the client's care plan. Question number three. Nursing care plan should be individualized to the client's diagnosis, client's need, client's preference, all of the above. The correct option is the all of the above because the nursing care plan should be individualized to the client's specific need and the preference. Question number four. The nursing care plan should be options are concise, clear, measurable, and all of the above. The correct option is all of the above. The nursing care plan should be concise, clear, measurable so that it can be easily understood and followed. Question number 5. Nursing care plan should be updated as the client's condition changes. The correct option is true because the nursing care plan should be updated as the client's condition changes to ensure that the care is being provided is still appropriate. Next question. Which of the following is the nursing diagnosis? Options are risk for infection, impaired gas exchange, ineffective coughing, and all of the above. Here, the correct answer is all of the above because a nursing diagnosis is an assessment that reflects a client's actual or potential the health problem. Question number 7. Which of the following is a SMART goal? The clients will improve their sleep quality. The clients will decrease their pain level by 50%. The client will be able to ambulate independently. The clients will be able to identify their coping mechanism. The correct option is option C. The client will be able to ambulate independently because a SMART goal is a specific, which is a S for specific, M for measurable, A for achievable, R for relevant, and T for time bound. Question number 8. Which of the following is an intervention? Provide the clients with the background, teach the clients deep breathing exercise, monitor the client's vital sign, and all of them. The correct option is all of the above because the nursing intervention is the action and the nurse take to help the clients achieve their goal. Question number 9. Which of the following is a nursing action? Administer medication as ordered, document the client care in a chart, educate the client about their condition, all of the above. Correct option is all of the above because nursing care plan it is a specific task that the nursing carries out that implement the nursing care intervention. Question number 10. The evaluation step of the nursing process is used to determine if the nursing intervention were effective, revise the nursing care plan as needed, document the client's progress, all of the above. Correct option is all of the above because the the evaluation step of the nursing process is used to determine if the nursing interventions were effective and to revise the care plan as needed. Question number 11. Which of the following is the most important factor to consider when prioritized nursing intervention? Options are the urgency of the clients needed, the complexity of the intervention, the availability of resources, and the client's preference. The correct option is option A, the urgency of the clients needed. The urgency of the clients needed used in need the crucial in the determining the priority of a nursing intervention as it helps to address the critical issues promptly. Question number 12. The nursing care plan should be reviewed the updated at least. Options are every shift, every 24 hours, every 72 hours, as needed. The correct option is every 24 hours. A nursing care plan should be reviewed and updated at least every 24 hours to ensure it aligns with the client's changing needed and status. Question number 13. The nursing care plan should be documented in the client's chat. Nursing care plan for both A and B and none of the above. Here, the correct option is both A and B because the nursing care plan should be documented in the both clients and client's chat and the specific nursing care plan from to ensure accessibility and clarity of the care plan. Question number 14. Which of the following is the nursing diagnosis that is appropriate for the clients who is unable to meet their own personal hygiene needed? Options are self-care deficit breathing, impaired ability, ineffective coping, and a risk for infection. The correct option is self-care deficit breathing because the nursing diagnosis self-care deficit breathing describes the client's inability to maintain the personal hygiene as needed. Option Question number 15. Which of the following is a SMART goal for the clients who is unable to ambulate independently? Options are the clients will be able to ambulate with the assistance of a worker. Next, the client will be able to ambulate for the 10 minutes at a time, 3 times in a day. Next, the client will be able to ambulate independently. Next, a client will be able to increase their activity level. The correct option is option B. The client will be able to able for 10 times at a time, 3 times in a day. Question number 16. Which of the following is an intervention that is appropriate for the client who is at the risk for skin breakdown? Options are to provide the skin care education to the clients and family, keep the client's skin clear and dirty, use moisture barrier cream to protect the skin, and all of the above. Here, the correct option is all of the above because all the mentioned interventions are appropriate for the clients at a risk for the skin breakdown to prevent the skin damage. Question number 17. Which of the following the major action that is appropriate for the clients who is receiving the nasogastric feeding? Options are check the placement of the nasogastric tube before each feeding, evaluate the head of the bed to 30-degree angle during the feeding, flush the nasogastric tube with the nasal saline solution after each feeding, all of that. The correct option is all of the above because all the mentioned action are appropriate nursing intervention when the client is receiving the nasogastric tube feeding. Question number 18. Which of the following is the nursing diagnosis that is appropriate for the client who is experiencing anxiety? Options are ineffective coping, risk for injury, impaired gas exchange, and ineffective fluid volume. The correct option is option A, that is ineffective coping, because the nursing diagnosis ineffective coping describes the client's inability to manage the stressors and adapt to life changes. Question number 90. Which of the following is an interventions that appropriate for the clients who is experiencing the anxiety? Options are: provide the clients with the quiet and comfortable environment, teach the client relaxation techniques, administer the medication as ordered, and all of the above. Here, the correct option is all of the above, because all the mentioned interventions are appropriate to help the clients experiencing anxiety. Question number 20. Which of the following is the nursing action that is appropriate for the clients who is experiencing pain? Options are: assess the client's pain level the using a pain scale, administer medication as ordered, provide the clients with the non-pharmacological pain relief measures, and all of them. The correct option is all of them, because all the mentioned actions are appropriate nursing intervention for the clients experiencing pain. So, if you like this video, then subscribe this channel and press the bell icon so that you can get the immediate notification as soon as after uploading the video.